everyone. Good evening, everyone, from wherever you're joining us from. It's another Friday, and I welcome you all to the Better by Choice Facebook live chat. Yes, today we're going to be talking on one very special topic, as you can see on my screen. Today we're going to be talking about vaginal discharge. Yes, and I'm not here alone. I'm here with my co-host, who are Eukaria. Eukaria.
Yes.
Yeah, good evening. Welcome.
Evening. Thank you so much.
Welcome. All right. Yeah, we can just get started, right?
Okay.
Yeah.
Okay. Good evening, everyone. I want to specially and also welcome you to our today's special episode of Belle by Choice Facebook live chat. Just like my co-hosts have just mentioned that today we are talking about vaginal discharge.
Yeah.
I don't know, maybe you go back to, okay, there's no problem. Just continue. Just let it be there. We are, you just like you all know that our work, our emphasis centered on the young women and girls' sexual and reproductive health. And we all know that vagina is one essential and very unique part of reproductive system. There's no way you can talk about reproductive system without mentioning vagina or without considering vagina. So that is why we took it so personal or so interesting to talk about vaginal discharge. So the vagina itself, please, can you go to the picture? I think go to the image, please. Exactly. The I wouldn't want to, please, the image, no, the vagina image where you have the reproductive organ, yes. Yes, that is the picture I want you to share so we could look at it together. Because most time, even as a young lady, when I was growing up, when they mentioned vagina, I just look at it as, okay, maybe the major labia, maybe the clitoris or the what. I just lumped everything together and then just conclude, okay, this is my vagina.
Yes,
exactly. So that's why I took exactly. So that's why I took our time to say, okay, let's see this image together, because it is not what I used to think or what some of us must be thinking out there. We have the vagina separately from either the labia majora or the clitoris or the urethral tract or rectum or whatsoever. So the vagina is an elastic muscular canal with a soft, flexible lining that provides lubrication and sensation. And from the picture, you can see the line where it is labeled the vagina and not that of the rectum, the vagina. Yes, exactly. You see the where you see the hymen down and then you see the vagina up. So the vagina is a very essential part of the reproductive organ of a woman or of a young woman or a woman. Let me just put it that way. So the vagina is also, like, it serves as a passage for the penetration of penile organ during sexual activities. So it's possible you could have sexual activity through the anal region or maybe oral sex. But when it comes to childbearing, it must be through the vagina. So you see how important it is. Then also, it is also a very important aspect where the child is being passed through during childbirth. So it is not possible for a child to pass through the rectum region nor the urethral part. It must be through the vagina, because it is the vagina that connects the the vulva through the cervix. So that is the only passage where it is responsible for childbirth and also penetration during sexual intercourse. Also, today we are talking about vaginal discharge. So it will be so important for us to understand that vaginal discharge, we are so particular about vaginal discharge and not rectum discharge or the urethra. When you go to urethra, you have something like we're talking about the pee. So where you can pee through, and also the rectum has through is the anus region where you could poo or pass the excreta. So initially, just like I mentioned, that when they mentioned vagina, I just look at everything as okay, one thing, and there's no separation. I don't think it's like this and the rest. But
Hello, Ikiri, are you still with us? Hello.
yeah, can you hear me?
Yes, I can hear you.
Okay, thank you. I was cut off by network. So the vaginal discharge, we are particular about the vaginal discharge, what comes out of the vagina. So the kind of discharge or bring out something. So that is when you mention, that's what we talk about discharge, maybe to release, to evacuate something. So any fluid that comes out of the vagina, that's what we are particular about today, and not maybe what comes out of the rectum or the urethra. You know, sometimes when we go to the hospital, maybe a doctor trying to take our history, say, doctor, maybe I'm urinating with pee, or okay, I'm having a discharge, something is coming out of my vagina or something, blood. The first question they will ask you, are you sure it's either from your vagina, which they will need to be certain at the particular place at which it's coming from. So that's why we are being particular. We are talking about vagina discharge and not any other. So the vaginal discharge itself serves as an important housekeeping function in the female reproductive system. Fluid made by glands inside the vagina and cervix carries away dead cells and bacteria. So there's one of our episodes we talk about vaginal, the care for vagina. And we had a lot of instances where young women and girls, they prefer cleaning their vagina with soap, with their fingers, with a lot of things. They feel, okay, their vaginas are not clean enough. They are not okay enough. So I have to put my fingers, I have to look for something to clean it. But here they are letting us to understand that vagina is self-cleansing. So it has its own way of cleaning itself. So removing the dead cells that, okay, or bacteria that are not okay to the vaginal walls. So this vaginal discharge helps to bring them out. So you don't need to bother about, okay, my vagina is not clean. You don't need to bother about, okay, I need to clean, just like you brushing your teeth. Please, you can brush your teeth as many times as you want. But when it comes to vagina, you dare not touch in the name of, I want to clean. It is self-cleansing. It cleans itself. So it's as in the approach of cleaning, it also helps to keep itself protected from any form of infection. So you dare not try to introduce any chemical or any harmful substance to it in the name of cleansing. I know some girls will tell you, okay, I need to clean my vagina. There's particular, I want to scent fine. I want it to smell nice from the inside. So I want to feel it. So they prefer to either spray deodorant or whatever to see how, okay, they can keep it clean. No, it is not okay. So it is self-cleansing. That you should know, that it is self-cleansing. The next slide, please. So
this one.
We mentioned that vagina the discharge it helps to keep the vagina itself clean and also to prevent infection. So you may be worried or disturbed that, okay, what should I consider vaginal discharge to be too much? When should I consider it to be too much or should be okay? So here we got this information that a normal amount of vaginal discharge in a 24-hour period ranges from 1 to 4 milliliters. So 1 to 4 milliliters is like just like under a teaspoon at most, like just under, not really a full teaspoon. You know, when we talk about, we all know what is teaspoon. So you should use the initiative. Sometimes you may be thinking, okay, maybe after this discharge, I have to go and measure it. No, you should understand that, okay, this quantity is not really much or something. So as a young lady or young woman out there should be sensitive enough to know that, okay, this discharge is becoming too much, or it's normal, or it's okay. But I think we have the quantity which is written. You may not have something to measure it, but you should be able to know that, or you should be sensitive to know that this is too much or it's more than what I should have seen. So there are other factors, a lot of factors, different factors that can influence color, smell, or amount of discharge, from ovulation and pregnancy, or infection and stress can when as a normal young woman, when you're approaching your menstruation, you begin to see there's increase in discharge, where you notice that your panties will be wet, or when you're approaching your ovulation, you notice your panties will be wet. But after your ovulation, you notice dryness, or immediately after your menstruation, few days to your ovulation, there's this dryness that a young woman feels. And you know that, okay, at this point, it must not be the same. So some factors that triggers or that increase vaginal discharge could either be ovulation or pregnancy. Pregnant women tend to also have discharge as compared to a non-pregnant lady. So that of a pregnant woman is normally higher or much than that of a woman who is not pregnant. So that is how you should understand that, okay, this is what. So that's what you should consider when you have any vaginal discharge. So you should check the period at which you are. Am I approaching my ovulation? Am I approaching my menses? Did I just conclude my ovulation? So those are the kind of questions you should ask yourself to understand or to know if your vaginal discharge is normal or it is not normal. So is it normal to have discharge every day? Okay, fine. For women who are menopausal stage, like women who are approaching their menopause stage, it is normal to have approximately 1/2 to 1 teaspoon. So it is, research have also told us or made us to understand that once you're approaching your menopause, there's likelihood that you have more discharge compared to when, okay, you are still at your age of active reproductive age. So it is much heavier when you're approaching this stage. So at this point, you should understand that, okay, this is a stage I am. But also it must be clear, white, thick mucus like. It must not be either yellow, red, or maybe too heavy for you to say, oh, okay, because I'm approaching my menopause. No, you have to check the color. You have to check check some factors before you consider that, okay, I am approaching my menopausal stage. Okay, this is the reason, or this is the factors. So those are the things you should share. You shouldn't just sit down and then conclude that, okay, because I'm approaching my menopausal age, that's where I have to, that's why it's this heavy. Remember, you have other vaginal condition that could lead to heavy discharge. Also, we need to also understand that the quantity varies depends on, okay, how varies from woman to woman. It's possible that lady A has it more and the other person has it less. So it must not be the way you are. It must not be that, okay, this person said, okay, her own when she was approaching this stage, or what she sees a day is not like this. Why is my own different? You should also understand individual differences. The system must not work the same. Everybody has the way your own system works. So you should also consider that when you see things or see that kind of vaginal discharge that you're not comfortable with. So okay, here is watery discharge. Yes, watery discharge is typically normal and can be due to natural hormonal fluctuation that occur during reproductive process in a woman's body, like ovulation, pregnancy, or during sexual arousal or menopause. Yes, when you're, just like we mentioned initially, that you should understand, one thing is understanding your system. So you having a watery discharge, it's normal as a young woman or a young girl. But what you should consider, you should consider is the quantity. So it could be watery and then small.
Yes.
But another thing is if it's watery and very heavy or consistently, you know, something that is coming out so frequently, then you should be concerned about it. So you should not take it, okay, since it's watery, they said watery discharge is okay. The quantity matters a lot. The quantity matters a lot. So the quantity, the color, and then a lot of some other factors, you should consider them. So, but by the time you begin to come out like P, then there's something associated with it. It could either be STD. So in that case, you need to seek medical attention. If it's watery and then it's like P, or it's coming too much, or it's coming more frequent, then you should seek doctor's attention for better advice to guide you on how to handle it. Hello, Liz, are you there?
Yes, I'm here. I'm here. Can you hear me?
Yeah, next slide, please.
Yeah, I've done that.
Okay. Here is healthy vaginal discharge. When you have a healthy vaginal discharge, it will be clear. It will not just be clear, it will be kind of milky, not very milky like the milk you take. But you should understand that, okay, this is quite subtle and it scents pleasant, not very unpleasant, and then you feel, okay, my discharge is healthy. You should look out for the color, which is quite milky. You should look out for the scent. Does it have any foul smell? Does it have any offensive odor? All of those things you should try to check out for all of those things. But when it is healthy, it's either milky or it scents okay and not having any kind of offensive odor. Then also you should understand the period at which you are. During your menstruation, or when you're approaching, or you just finished from your menstruation, the discharge likely changes. It must not be as the same as, okay, normal one when you are not menstruating or when you are not approaching your menses. You know, normally our women menstruation comes with kind of smell, which is not like that of a normal discharge, which is not like, okay, discharge. So because of all of those menstruation particular linings that comes out, its smell is quite different from that normal discharge. So when you just finish from your menstruation, so you could give it a try and say, okay, maybe it's because I'm just rounding off from my menstruation. That is why I have this kind of discharge, and that's why it's sent in this way. So that's a factor too you should check for during checking out for your vaginal discharge. So the thickness. So you should also consider the thickness. It shouldn't be too cheesy or too thick. So when it's too thick, it's also faulty. So when should I be concerned? When should I be concerned? Yes, it's very important that you should know when you should be concerned about your vaginal discharge. When you have greenish, yellowish, thick or cheesy vaginal discharge, strong vaginal odor, redness, itching, burning or irritation of your vagina or the area of skin that surrounds the vagina and urethra. Sometimes we just conclude, okay, I don't have any issue, I'm okay, I'm fine, and it's just a discharge now. I'm having small itch. It's not really like itch. There's no form of itching. So itching is a factor that you should understand that, oh, I'm having some discharge and I'm also having itching. Then the color of it, just like I mentioned earlier, you look at the color, then the smell. You see one offensive odor. Sometimes you don't even need to remove your panties before you start perceiving those odor. Even as you are sitting as a young lady, you notice that when you is it what, like when you pollute, or like, let me bring that instance. Lizzie, please, are you there?
Yes, I'm here.
Yeah, when you as an individual, if you pollute, the first person that receive the smell or the odor, it's yourself.
Yes,
is yourself. So it's just so simple as that. So once you have this vaginal discharge that is smelling, or the odor is not pleasing, you perceive it yourself before the next person close to you. So all of those things, those are the things you should check out for, and then seek medical attention. You need to, because a lot of times young women and girls just sit at home and conclude and say, okay, I think the other time I have vaginal discharge that was heavy, and one pharmacist prescribed one drug like this. Then you just rush to the chemist and then pick that particular drug. It is not advisable. It is not advisable, because you don't even know if it is another condition different from the previous one you had, and then you keep treating one thing, and then at the end of it, it leads to a different complication. So it's advisable that.
Hello, Kira.
Exactly. So it is any of this discharge or hello?
Yes,
can you hear me?
Yes.
So once you notice any of these dangerous, let me call it dangerous factors, because sometimes you just sit down and then conclude that it's nothing. Meanwhile, it's something big out there. So once you notice most of these signs or symptoms that are quite dangerous, kindly visit the doctor for proper advice, because it is the doctor that will advise you on the kind of test you need to do, then probably come back for treatment.
Yes.
The next slide, please. Okay, from the slide, you could see the colors of vaginal discharge and what they can mean. We have clear. When you have healthy discharge, pregnancy, ovulation, hormonal imbalance, that's, you see a clear, that's clear. You don't seem to see either if it's white or you seem to see yellow or pink or anything. Then when it is white, you have healthy discharge, yeast infection. So sometimes you say you have white discharge, it could be yeast infection alongside. So you have yellow-green this color. You have it could be sexually transmitted infection. So these are, so within yourself, you could see this color. You see red is sometimes menstruation Beautiful. So you don't just conclude that, oh, my discharge is not clear. That's why I mentioned earlier that you consider it is so important that you consider the stage at which you are. Are you approaching your menses, or did you just finish from your menstruation? So it's a very big factor to change your vaginal discharge. So menstruation, then cervical infection. I think we had this section last time.
Yes.
Dr. Robert mentioned it. The cervical infection and cervical polyps, all of these could make you have a red discharge. Then we have pink, we have cervical bleeding, vaginal irritation, implantation. Implantation, that's when for those that have given birth or those that have taken in, you know, they said when the egg initially implants before it forms into baby, they used to be, you have a pink discharge. That's bleeding. It's not really much. You must not have something much, but something that will at least stain your pants and you see it and notice it. So usually pink. Then gray could be bacterial vaginosis. So all of this, this is just an insight to young women and girls out there. It is not for you to conclude that, okay, once I have this, okay, this is what is wrong with me, this is what's wrong, then you start trying to self-diagnose and self-treat yourself. It is still very important to seek the attention of a medical practitioner to guide you right. Then some of the vaginal conditions we have vaginitis, genital wart, trichomoniasis, bacterial vaginosis, herpes simplex virus, gonorrhea, chlamydia, vaginal cancer, vaginal prolapse. All of these conditions, we will have time, maybe our subsequent episode, and talk more and deeply. Yes.
Yes, because
our young women and girls are there.
Because I'm sure a lot of our women would want to, you know, they would see these words now, and they'll be like, what does all these words mean? So really have to, maybe in a subsequent live chat, we'll also delve into it more.
Yeah, they have to stay tuned. If you are really interested, and we hope, and we are telling you, are promising you that it's really interesting. So you have to stay tuned in our subsequent episode to key in and gain more knowledge. Okay, the next slide, please. Okay, some of the ways you could prevent bad vaginal discharge. It is important, just like young women, it's important you go for whole body check. Sometimes we just conclude and say, I'm fine. You know, we let me just say, we Africa, it's so difficult for us to just walk up to the hospital and then say, I want to check myself. If I'm not sick, something must take you to the hospital. It's either headache, stomach ache, or hand pain or something. So it's
even headache. Most of them don't go to the hospital. They will just go to one roadside chemist.
Exactly. So as a young woman and girl out there, women and girls, once you're in the stage of reproductive, even if you feel you are still an adolescent and you feel okay, notice something, you must not notice something. You see, sometimes like the funniest part is that even when the services are free, you still need to beg them to come out for screening. So it is important that you go for a body check yourself. Like I think in one of those episodes, I encourage girls from 25 years to go for scan. It is very important. Because at that stage, you are ripe for marriage. A man can just approach you and then you get married, then you go in and then start. It's good as a young lady from 25, if not below, you go for scan. Check your reproductive system, what is happening there. Look at it, just like you seeing your face in your mirror. So it's very good to you go for scan. It's right. So what you eat too matters as a young woman. It also affects your reproductive system. So it is also you eat. You remember it is the same cells that circulate or works in other parts of your body that you also have some in your vagina. So you need those cells to live fine. You need those cells to be healthy. So you eat right to also help you. So you control your weight and exercise. All of those things has a good way to keep your vagina discharge healthy and safe. Get regular screening. Do not walk or treat in assumption. I have mentioned it. So you don't need to just assume and say, okay, this is what is happening to me. Let me do this. Use cotton material for underwear. It is very important. Young women and girls, want to follow the trend, want to do what others are doing. So it doesn't matter if the panties are just one nylon or something that could just cause heat and then give you irritation in your vagina walls and leading to discharge. So you check what to wear, your underwears. Make sure they are clean. So it will help prevent your vagina from any form of infection. Then use condom. We mentioned what is easily or what organ that easily penetrate the vagina is the penile organ. So you should be sensitive enough, or you should be cautious enough to keep that penile organ clean and also protect it with condom during sexual intercourse to prevent any form of infection. Then you can also just use water. I had to put that just use water because most people don't feel comfortable. They don't feel satisfied when they use water. Just water. The water is not even you putting it inside the narrowing or the passage. Is the outer wall that is connected to the vulva. So you just use warm water. It's okay. It will clean everything. Once it's just like we mentioned, it's self-cleansing. You don't need to choke water or put water in syringe to put it inside. Consider natural lubricant. Number one natural lubricant, it is the vagina itself. Lubricate itself. Even if you want to go into sexual activities, or with just a touch, you should be aroused, and then the lubricant secrete, and then it softens it. So if not that one, you can also go for other water-based lubricants that are made without any form of chemical. So I understand some women or some guys that when they are in haze, they could just use cream, or they tell you, oh, they say this thing is lubricant and it could soften. You don't know what is contained in that particular cream. You've not checked the content or chemicals they use or whatever. So it could also affect or cause a lot of discharge for the young women. So you should be cautious about it. Thank you, Lizzie. I think that comes to the end. I've come to the end of my presentation for today. Okay. Any other question or concern? We can deliberate.
Thank you so very much, Yukiria. You really did justice to today's topic. We would, before we go on with questions, because I can see there are some questions down that some women have put down to ask. So before we go on with it, I noticed Dr. Robert is also here with us. Hello, Dr. Robert. Dr. Robert.
Yeah, hello. Well done.
Yeah. Thank you, sir.
Wonderful presentation.
Yeah. Good evening, Dr. Robert.
Yeah, good evening. You've done a very good job at the topic today. Well done.
Thank you.
Thank you, sir. So I would love for you to chip one or two things in on what you know, something about vaginal discharge before we move on with the questions, sir.
Or maybe we should finish the question before he comes in. Don't you think so?
No, I would like him to comment. Yeah, and I'm sure he has something that I would like to say.
Basically, whichever, it's okay. We can take the questions as well. What I would just say quickly, just very briefly, because she has touched on most of the important areas with regards to abnormal vaginal discharge. It's something that is normal, and how to identify the abnormal vaginal discharge. Okay, she has added on that on both the color, consistency, volume, and whether or not it's associated with a bad odor or if it's malodorous. Okay. The key things I wanted to just say, which we see commonly in practice, is that also sometimes following antibiotic use, you can have an increase in vaginal discharge. That in most cases will clear off once you stop the antibiotic. So you don't have to get alarmed if you realize you're taking an antibiotic and then you start having abnormal vaginal discharge. If it persists, then you can seek further action. Then that it's not only sexually transmitted infections that causes abnormal vaginal discharge. Okay, so if you see a child who is not yet in the sexual and reproductive age coming in with an abnormal vaginal discharge, it doesn't always mean that the child is sexually exposed, because we see that sometimes with either elder sisters that bring in their younger sisters for checkup, or parents who bring in their children for checkup. Okay, sometimes, just like I said, antibiotics use and all that, can cause abnormal vaginal discharge, or the vaginal hygiene technique can be responsible. And when you are advised, they do the proper thing, the discharge goes away. Then in children, more so, if we see abnormal vaginal discharge, or those not yet in the reproductive age group, we should not forget to think about foreign body insertion. We see that a lot also. Little children insert foreign bodies into their genitals, okay, that might now stay there and begin to trigger more abnormal vaginal discharge. So foreign body insertion, and then also sexual abuse, okay? We also see that where a mother can be taking care of a child, you are beating the child regularly, you notice abnormal vaginal discharge. That should be something you should also think about with regards to sexual abuse from maybe anybody at all. So thank you very much. I think we can continue when we have questions.
Thank you so very much, sir. Thank you, sir. All right, let's at the last Belle by Choice live chat, there's some questions that some women ask, so maybe we'll just treat it first. So the lady is asking, what causes occasional and persistent vaginal and vulva itching without stop, and what can be done to put an end to this itching? Dr. Robert or Yakira?
Okay, kindly read out the question again, please.
Okay, says what causes occasional and persistent vaginal itching, and what can be done to put an end to it?
Okay. The Dr. Eva had just mentioned a very important point that not all vaginal discharge must be either sexually transmitted infection or any, it could be just like medication, just like he has mentioned. Also, when I was presenting, I mentioned your underwears. You remember, I don't know if you anybody have experienced it, when you wear panties for a very long time, and then maybe the whole day you've been out the whole day, and you came into the house and removed, and you start having some itches. So it could be a result of, okay, maybe long or prolonged use of a particular panty, or heat, or the area you've been, or something, one thing or the other. Then also it could be infection. That is why I said, then if it will maybe be the reason of a prolonged use of a particular panty or nylon kind of, when you are during your menstruation, when you use type-ons that are not wool kind of, they likely cause itching. So you can check out for those factors first. Look around. Maybe after coming, you take your bath, rest, and then you see if it persists, then is a cause to seek for medical attention. But if it doesn't, then you should know that, okay, it was because I used this for a very long time, and then you have to free yourself. It's also advisable that as a young girl or a young woman, you shouldn't use panties to bed, because at that point you keep using panties throughout the day, and then when you want to rest, you need air. Or even if you are using, it should be a free dress that you are using to cover yourself, and not always tighten that area. So you need air too to make it feel better. So if you notice that these things comes and go, and then it calls for attention, it calls for medical attention. You need to seek medical attention. But if you notice it, and then probably try one or two things, like I just said, shower, clean up, rest, free yourself from those kind of, from panties or something. If it goes off, you know that, okay, maybe it was due to that. But if it doesn't go off, then it could be any form of infection or vaginal condition, just like I've listed down there. Then you thereby seek for medical attention.
Okay, thank you very much, Ikea. Okay, to the next question. It says, is it normal to find pubic lice in any part of your body as a woman? Probably areas like your vagina. Pubic lice. Is it normal?
Pubic lice from the reproductive organ message, or sorry, the picture I shared. Did you see any labeling like pubic lice? Pubic lice. So it is not normal at all for you to see that. It is not part of your reproductive system or reproductive organ. So if you have that, it's just like how do I even put it? Hygiene is very important as a young woman.
Exactly.
You need to keep that area very, very clean. So you could, for you to even see pubic lice at that area, you should know that, okay, this person is not really is unkept to form situation. Like most people, most cases, like when you go to crowded areas, or you go to where the kind of environments are not clean. So those kind of things are bound to happen. Or when you keep still underwears, underwears are dirty, then you store them, then it's bound to happen. So they're not supposed to have pubic lice. It's not normal.
Hello, Yukira. We can't really hear you. The line is breaking.
About Dr. Arveda, you did.
Yeah.
Me now. Let me or Dr. Robert, please.
Hello, Yukira.
Is it me or Dr. Robert, please?
No, it's you. We could not hear what you were saying clearly. The line was breaking.
Okay, I mentioned that for you to have pubic lice, it's bound to be that, okay, you left your underwear unwashed, or where you are settled, maybe in crowded areas. It's basically associated with unhygienic situation. So we should understand that a young woman, or as a young woman or a young girl, your reproductive organ should be kept clean, including your underwears you use, or where you stay, or where you sleep. It shouldn't just end in your clothes. So sometimes when you go to a particular place, I remember there's one time I visited one hospital and I just sat on the bench, and before I noticed, something bit my buttock. I stood up immediately and noticed that there was lice on that chair.
Wow.
So you can imagine. So immediately I was sensitive enough to understand that something happened. I stood up immediately. And when I came home, the first thing I did was to remove my trouser. Whether it was there or not, I had to use hot water and sterilize.
Hello, Ikira, are you still here?
So you understand, once as a young woman, when you do things, there's nothing there. You see, as a young woman, seeing pubic lice, it's really, really not okay, because that is not part of, it shouldn't be part of you at all. So that's associated with.
So part of the things she needs to do is to leave the dirty environment and take care of her underwears, right?
Exactly. You have to take care of the environment to stay. So if you take care of your underwear without taking care of the environment to stay, it's bound to come back again.
Again, yes.
So you check out the surrounding you are, where you live. It should be neat enough so you don't have them again.
All right. Thank you very much for that. All right. There's another question. A lady is asking, I'm 28 years old. I have some rashes on my genital and a swollen clitoris, like pimples, with itchy, creamy white discharge coming out of my vagina. Please help me out. I mostly get infections a lot. What can I do to stop all these infections and the swollen clitoris?
Okay, just like we've mentioned, this is our Belle by Choice Facebook live chat. We are here to sensitize women on various reproductive issues and how they can be managed out there. But what we always advise is fine, just like we have mentioned, what she mentioned, it is not normal.
Yes.
So what we could tell you on this platform is what you're experiencing is not normal. Then the next thing we'll say to you is seek medical attention. So where is your location? So whichever place is your location, kindly seek for medical advice. Where you have a professional, you have a doctor to take your history to, it's not just giving you solution. Exactly, we need to take your history, know how many times have you experienced this, what and what has happened. This is what we need to do. The medical practitioner will refer you for a proper examination to really ascertain the particular issue, or if it is infection, the particular infection. We have different infections. It cannot be just one. So you say, okay, it's a general medication, just go for this. So at this stage, we will help you by telling you to seek medical attention in the closest or nearest facility around you. Very, very important and urgent. Thank you.
Okay, thank you, Kira. There's another question here. It says, is it advisable? Okay, Dr. Roberts, yes, sir. You can speak, sir.
Okay, yeah, I know definitely there will be a lot of questions on this
topic on this.
Because definitely, even in the clinic, is something that is always very common. Okay, yes. So just to add to what the presenter has said, there are a host of things that can actually lead to abnormal vaginal discharge. If you know the normal, then the abnormal vaginal discharge. And what I tend to tell people is you categorize them into the sexually transmitted causes versus the non-sexually transmitted causes. Now, in my experience, I think most of the causes of the abnormal vaginal discharge we see are sometimes not sexually transmitted, okay? Yes, the sexually transmitted causes, of course, you have your sexual partner's limited use of condom is the main stay in prevention of sexually transmitted causes like gonorrhea, gonorrhea and co. But what we tend to see is that sometimes, like she has talked about, not using antiseptic soaps. There are a lot of products here and there for vaginal cleansing. But we've heard from the lectures today that the vagina is a self-cleaning organ. So we tend to see that those people practice some of like those douching or wrong vaginal cleansing practices, use of antiseptic soaps. It distorts the normal flora of the vagina and then now keeps you in a position where you have a dis or an unbalanced vaginal flora, and then you now be prone to having those recurrent abnormal vaginal discharge and even symptoms like itching. Okay, so things like vaginal candidiasis can give you, that thick, milkish discharge that is associated with serious, sometimes very intense itching. Okay, like one of the questions that was asked there. So if you dive in deep, you realize that apart from giving the antifungal drugs, if the person goes back and continues these practices, he will continue to have those recurrent symptoms after he stopped taking the antifungal medication. Okay, so it's something that is holistic. You need to discuss with your healthcare provider to ensure that you find out exactly what is responsible for the recurrent abnormal vaginal discharge. It's not only STIs, okay, as most people think that is responsible. If it is due to STI, then it's important that when you treat, you also treat your sexual partner, okay? So that you don't have that recurrent abnormal vaginal discharge. But please, our hygiene practice for the vagina is very, very important to prevent those recurrent kind of symptoms. Thank you.
Thank you so much, sir. Thank you very much for that wonderful contribution. Okay, yeah, so let me ask the final question. Is it advisable to use these lubricants? Because I remember But Eukarya mentioned considering natural lubricants. So is it advisable to use all these lubricants? Eukarya.
Okay, I mentioned that first, what you should consider first, it should be the self lubrication, which I mentioned that the vagina lubricate itself. So if that is not readily available for our sexually active young women and girls who want to not do it based on pleasure, we have water-based lubricants that are safe. So you can get those ones over the counter. So just like I mentioned that some people don't go for this water-based lubricant that are safe. They rather go for either something cream. They say, okay, this is slippery, or which they don't know the content or the content or what the ingredients per se that is used for this lubricant. So if it is water-based lubricant that is getting over the counter, it is safe for you to use. So you can actually use that. And not the substitute one that you could get any. I said, like, you know, now the cream you rub on your body. I've had experience or a chart where a guy said, normally we use this cream and then it works. But you could, to your greatest surprise, after the whole deal, the lady might come down with a different vaginal issue or thereabout.
Okay, thank you very much, Kyria. Let me go to Facebook and see if we have other questions.
Okay, while you go ahead and look for some question, I think just like our program is about Belle by choice, advancing young women and girls' sexual and reproductive health. Well, I think in some of our episodes, we had a client or one young lady mentioning that, okay, I'm using pill, which is an oral contraceptive as a form of a family planning method, which I'm using. And what I noticed, normally all of these methods, there's either one or two things you either face. It could be weight gain, it could be heavy bleeding during menstruation, it could be one thing or the other. And this young lady mentioned strictly that what she experienced was heavy discharge. And I think we also had our speaker convince us for that day that normally it is okay for the first few period of using that pill for you to have heavy discharge. It is nothing to worry about. If you're a young woman, you're a young girl out there using oral contraceptive, which is pill, and you experience this heavy discharge, it is advisable that you monitor yourself for some time. And if it doesn't stop, then you seek the health facility at which you were given such pill, and then probably change to a different method. That is why we have different methods. So you shouldn't just stop at, okay, this pill is causing me to have heavy discharge, then I have to know. But first thing you should know is that it's going to stop. Just give it, it's just a matter of time between maybe the first few weeks you just started it, because at that point your body is being introduced to a foreign object. So there's a high production of hormones, so thereby it also increase the rate of discharge, vaginal discharge. So in that case, you just have to be patient and be calm for the first few weeks. If it persists, then you can either change method, and then even if you change method and you notice that it's still on, then you probably seek medical attention. Maybe it could not be the pill that is the challenge, maybe something else. So I want to encourage us, don't say because of discharge you're not using oral contraceptive. Use it. If you feel it's not still comfortable for you, we have different enough for you to choose from. It could be implants, it could be injectable, it could be IUD or whatever you want to use, please use. And also use along with condom to prevent you from sexually transmitted infection. It is very important. Any other method will not protect you from it, but condom will.
Yes, so you said it all, Kyria. Thank you very much. Funny enough, I was about asking a question as regards contraception and vaginal discharge, but you already answered it. So I'm sure the lady that asked the question has already gotten answer to that.
Okay.
Yeah, let me quickly share my screen again. Thank you so very much.
Doctor's hand is up. Doctor's hand is up, please. Dr. Robert's hand is up.
No,
okay.
Okay.
All right. So yeah, thank you very much, presenter. I think you did a very good job at handling the topic today, and you know, you gave us a very important message, particularly with the condom. Whenever you hear her talk about the use of lubricants, she always mentions that water-based lubricant. That's because, you know, there has been this contentious issue of using the oil-based lubricants, like all those ones that are not well studied, like your Vaselines and all those other oil-based kind of lubricants. Yes. Because if you are worried about the integrity of your condoms, because using women who experience maybe vaginal dryness during sex that will have to use lubricants, it doesn't rule out the fact that you have to still use your condom if you are concerned about maybe HIV, AIDS, and the rest. So if you are using oil-based condoms that are not yet well studied, you know, you cannot guarantee the integrity, the interaction it will have with the latex condoms that are in use. So that's why even the World Health Organization recommends the use of those water-based lubricants rather than what we use, you know, commonly that are not well studied, the oil-based kind of lubricants.
Yes.
Okay? So just for us to be aware of that, let's be careful. And then if you are using any particular lubricant, most times the oil-based lubricants will not cause any kind of irritation. But some people have allergy to some of these products. But if you do, then you have to avoid those kind of products. Thank you.
Thank you so very much.
Thank you, Dr. Robert.
Thank you, sir. Yeah. Okay, everyone. Thank you so much for joining us today. I'm sure you learned a whole lot, because I really learned a whole lot. Today's session was impactful, was educated. Thank you, Kyria. Thank you very much for that. Okay, thank you so very much, everybody. We're still on the Belle by Choice Facebook live chat. So are you a woman with unmet sexual and reproductive health needs? Please do well to speak with our sexual and reproductive health experts today by dialing the numbers on your screen. And if you are in Cross River, you're in need of sexual and reproductive health advice, information, services, do well to visit the local government, visit the healthcare centers that are showing on the screen. We have healthcare centers in Calabar, Biase, Boki, Akpabuyo, Obudu, Bubra, Ikom, Etung local governments. We have in Obaniku, Ogoja, Udupani, Yako, Yala, Abi, Bakasi, Bekwara, Calabar South, and we also have in Akampa. We also have healthcare centers in Lagos, Ikorodu, Ikotun, Ibejuleki, on the island. When you call the numbers on your screen, they'll be able to help you with any sexual and reproductive health information you might need or services. We're still at the Belle by Choice Facebook live chat, powered by African Girls Empowerment Network. And all thanks to our amazing partners. Without them, we would not have the Belle by Choice Facebook live chat. We're saying thank you to African Women Development Fund, AWDF, Global Fund for Women, Women First Digital, Movement for Women Alliance, Cross River State Ministry of Health, UNFPA, and the National Primary Healthcare Development Agencies. These are amazing partners that have been standing by us and helping women across the globe have easy access to sexual and reproductive health rights, services, and information. We're also putting out a call for volunteers. You're a female doctor or a female nurse that is passionate about women's rights to pregnancy by choice. Make them carry Belle by choice, not by force. And you would like to join our Belle by Choice party team, do well to send us an email to operations@agenetwork.org or dial the numbers on the screen. Thank you so very much, everybody. Thank you, Eukaria.
Thank you, Lizzie. So much.
Yeah. Thank you. Have a wonderful weekend and bye. See you next time right here on Facebook, 5 p.m. to 6 p.m. Bye.
Thank you. Bye.
Okay.